I'm Dr. Polly Watson. I'm excited to bring back Dr. Elizabeth Cox for the second part of our conversation. If you missed her introduction, Dr. Cox is a board-certified psychiatrist with over 10 years of clinical experience. She did her training at UNC Chapel Hill. And what makes her really exciting to talk to is she's an expert in reproductive psychiatry, really focusing on how hormonal changes affect women's mental health treatment. Her practice is in Raleigh, and it's called Reset Health and Wellness, and it's based right here locally. So please join me in welcoming Dr. Cox back for part two. In part two of our conversation with Dr. Cox, we're going to be talking about the complexities around antidepressant medications and clues to help people know when they're on the wrong medication or if the medication is overdosed. We're also going to discuss genetic testing to help patients find the right medicine for them. So I hope you'll enjoy this conversation with Dr. Elizabeth Cox as much as I did. When you you maxed out the things and it might be time to consider pharmaceuticals, I mean, I was always kind of thinking about you might be trying to add in drugs when the person's not able to accomplish what they want to accomplish, right? So not necessarily you can't get out of bed in the morning, but you're opting out of life in a way that is not in concert with how you want to live your life. Like you're not gonna join that Zumba class, or you're not gonna join that book club, or you're pulling away from life. Any other thoughts on that?
Yeah, I mean, I think of things as like, what are your values? How do you want to show up in the world? We've got this life to live, and life is fragile, beautiful, short. Are you feeling your best self? And certainly we all go through hard times, and there might be a tough week here or there. But if consistently you're feeling like your anxiety or your mood symptoms are in the driver's seat, and that you're in the back seat just kind of like along for the ride, that feels problematic. You want to be able to be in the driver's seat and the symptoms are kind of in the passenger seat, you're noting them, or they're in the back seat, like we're talking about before, of the acceptance and commitment model. Like the anxiety might come up sometimes, some mood symptoms might come up sometimes, like it's not going to be totally gone, nor would we want it to be, but where you still feel like you're able to live the life you want to live and do the things you want to do. When we talk about symptoms, I think of them all as what is problematic. And this is so subjective and so different from person to person. What's problematic for one person might not be for the other, but identifying what feels like too much for one person, and if it's too much and they're not able to show up in the way they want to in their life, then that might be a reason to reach out and have a consultation with somebody in the psychiatry space and explore that a bit more.
Mm-hmm. Can you talk a little bit about side effects? So, in the perimenopausal population, when we have side effects of medicine like weight gain and sexual dysfunction, sometimes that's a really big red flag for people. And maybe you've got some hacks about moderating those or minimizing those. I think sometimes the side effects is the kind of the big elephant in the room that maybe prevents us from like asking more questions because we've just got fear there. And if we could clear out the elephant, if we could clear out some of the fear, maybe we could take advantage of things when we might really need them. So can you talk about side effects?
Sure, yeah. So I always encourage everyone to be aware of what they are and to speak up. The ones that are so feeling taboo are the sexual ones. Those are so hard to bring up. So I like to remind everyone, if they're taking that can happen, and you should always feel comfortable talking to your prescriber about that, because there are some workarounds. So I'll start with the sexual piece. So the sexual side effects doesn't happen to everybody. Some individuals that are so in their head and so anxious about things or really depressed, the sexual symptoms can be part of the condition and can actually get better, in my
Right.
experience, with the
Mm-hmm.
medication.
Mm-hmm.
But when it happens, it's difficulty with having an orgasm or fully feeling aroused. And that can happen with SSRIs or SNRIs. And so when that happens, a couple of options. One is adjusting someone's dose. Can we get away with slightly lowering the dose and still having enough symptom improvement? Sometimes that's an option. Other options are this, people don't love this one because it's adding in another medicine, but there are other medicines we can add in that somehow make that side effect go away.
Right.
Um, Depending on whether or not you're a good candidate for the medication. So some of these medicines have contraindications and are not a good fit for everyone, but sometimes we'll use Buspar or Wellbutrin. And for whatever reason, that can make some of those side effects go away. For some individuals, we'll just use a very low dose.
Mm-hmm.
Other options, there are different topical agents. So one is just an over-the-counter oil. A sex therapist had recommended this, and I've had some of my patients have had good success with this. It's a you just buy it. It's a company called Foria. Have you heard of this?
Yeah, yeah.
Yeah, and one of them has CBD in it, and who knows, but it's plant based and it can help increase blood flow. And you apply that externally before you're intimate, and can also work nicely as a lubricant. There's a compounding pharmacy
Mm-hmm.
that will make like an arousal topical cream that's kind of like sildenafil, Lady Viagra. If you're a good candidate, will have like a little bit of testosterone in it too, just small amounts that you would use topically externally just before you're intimate. Again, not everyone's a candidate for these things. And with that in particular, have had some patients do really well with it and others that were like, did nothing for me.
Yeah.
So it's kind of trial and error, but
We use
those are
this
some
too.
of
We
the
call it
things.
scream cream, which I think is
Yes,
fun.
yes,
But
yeah, yeah.
it's a topical vasodilator. So you're literally like trying to get more blood flow into the genitals quickly. So it's like,
Yeah,
whoa, I have a clitoris. Let's go. Right.
yeah,
You're,
yeah.
kind of turning off your brain a little bit. So
Yes,
yeah.
exactly. So those are all great options to use if someone's having sexual side effects. Weight gain. So in general, SSRIs and SNRIs are more weight neutral than some of the other mental health medications that will prescribe for other indications. There are some medicines that just are notorious for a lot of weight gain. Atypical mood stabilizers like Abilify, Zyprexa, Seroquel, Risperdal, and then in its own category of antidepressant, Remeron or
Hmm.
mirtazapine. Those
Hmm.
are all notorious for like a good amount of weight gain. Often will happen. And when that with those, we have our own workarounds. With SSRIs and SNRIs, the ones that would be more commonly prescribed for women going through mood changes around their hormones. The weight gain typically should be like 5-10 pounds max, more of like water weight. But that being said, everybody's different. So I'm always
Hmm.
open minded here. But if that kind of thing is coming up, then I want to make sure, again, sometimes it's just a bad fit and we will cross taper to a cousin and a different SSRI doesn't have the same effect. Everybody's got variable sensitivity, so I try to be very open-minded and receptive, and if we need to make a change, we will. When someone has those types of concerns, I want to slow down and look at what's your diet like lately, what's your movement like lately, what's your sleep. If you're not sleeping, then
Hmm.
like what if someone has sleep apnea? You're going
Right.
to hold on to weight. You're not going to be able to lose weight because your brain's not getting oxygen at night. So we would be exploring, is that happening? What's going on with your eating habits lately? Do we need to have a consultation with a dietitian? How can we kind of also address the full picture, but certainly if it really seems like the medication is the culprit, then we might just need to experiment with trying something different.
Right. Right. So there are options. There are options. You can make different choices. We can get more information. And then
Mhm.
for the medicines that are most commonly used, it doesn't sound like it's 20 or 30 pounds. It might be 5 or 10 pounds. So it's
Which I
not,
get, like five, nobody wants to be 10 pounds heavier if they don't
yeah.
have to be, so 10 pounds can, depending on your frame too, could be significant. But if it's 2 or 3, you know, I don't know. So that feels less problematic, but everybody's different. And if that's bothersome, that's also something that I hope patients feel empowered to speak up about. And this is, your life, and you're taking this and you have to feel good about it. So
Mhm.
it's important to ask for other options if you're not happy with what you're taking.
Right. So you kind of have talked a lot about how people are different. And so when we're thinking about the complexities of picking medicine, now there's genetic testing that might help healthcare providers, physicians like yourself, be able to make a more informed choice. So can you talk a little bit about genetic testing options? When you use it, do you use it on everybody to try to find the best pharmaceutical intervention when that's warranted?
Yes, absolutely. So I absolutely have used genetic testing, but I don't routinely order it for just everybody. So these types of tests, the companies will usually, it's very easy. They will send the equipment to someone's house, and it's just a little swab, and you swab inside your mouth and your cheek.
Hmm.
And
Hmm.
then you ship in the sample, and then we get back some results. And so this shows if you have any deviations or changes that are unusual in the enzymes where you metabolize medications. So, are you what we call a rapid metabolizer or a slow metabolizer at different enzymes? And so that can affect certain medications that are prescribed. So, that'll lump the medications into different columns. Green columns means there's no issue, you can use them as prescribed. Yellow is some precaution. You may need to have some changes with how you prescribe something. And then red columns means you typically might want to avoid them. If somebody's in the yellow or even the red, that doesn't mean that the medication could never be prescribed, but we would look a little bit in greater detail at what is exactly happening at those enzymes. So if someone is an ultra rapid metabolizer of something, then that would mean that they're going through it really fast, and they might need much higher doses than is typically recommended by the FDA. If someone is an ultra slow metabolizer, they may be having lots of side effects and would need microscopic amounts. Sometimes we'll have to get it in a liquid form or
Hmm.
just really low dosage. So it can be really helpful. I get that if someone just wants to have it because they prefer to have more data and they just want the information, then we'll get it if that's their preference. But when I would recommend ordering it, is if someone has had a lot of medication trials and none of them were fully efficacious and quite the right fit, then maybe we need to help guide us of which category of medications. Some individuals don't metabolize SSRIs as well, and they do much better with the SNRIs, for example. And sometimes this can save you the hassle of having to try as many medications and can give you that information. Or if you've had a lot of side effects, then maybe you're really sensitive. Sometimes I won't order the test and I'll just assume, okay, you've had side effects with things. We're going to go really cautious and conservative with the dosing without having to have this kind of test. But it can be helpful in that population.
It's nice. It's nice to know that we've got options. I think particularly patients that are at midlife now and maybe took antidepressants around the postpartum period, things really have changed since then. And I think sometimes people just felt like they were getting a medicine pulled out of a hat. And so it's nice to be able to have some ways to gather more information, kind of
Yeah.
personalize the approach for people, especially like you say, for people that have had complications or they've been on a lot of different things that haven't felt right. So I love your experience and expertise in looking at mood changes around hormonal change. I think that's such a fantastic niche to be in that women need right now, right? We've always needed it, but it's really great that people like you are out there. So, can you just tell us a little bit about your practice and how folks can work with you?
Sure, yeah, absolutely. So I work with all genders of patients, ages 18 and older, and see lots of different conditions, but I do have this specific niche and focus additionally on the reproductive psychiatry piece. So if you are concerned about mood symptoms surrounding your periods or during times of hormonal change, pregnancy, infertility, postpartum, perimenopause, that's an additional area of expertise. And my practice is based out of Raleigh, and I offer both virtual appointments for patients located across the state of North Carolina, but you have to be located in North Carolina, and then also in person in Raleigh. My office is near Cameron Village, and I love working with patients, and I'm really passionate about collaborative care with other clinicians like yourself. And I'm also so grateful for you and your expertise about it. They can
Yeah,
find
thank
me.
you.
Reset Health and Wellness is the name of the my practice, and so my practice website's all spelled out one word: resetyourhealthandwellness.com, all spelled out. And
We
you can
will
just
link.
click book now.
Perfect. We will link to that on the show notes. So thank you so much, Dr. Cox. We are so glad to work with you and just know that you're out there as a fantastic resource, because I think what I feel from this conversation with you is this balance, this gentleness, a lot of choice, a lot of partnership, right? And I think so often women are offered antidepressant medication without a lot of this kind of more nuanced conversation, and they feel like they've been put off, and then they're closing themselves off to something that might actually be helpful, but they have fear around it, they felt shame around it, they felt judgment around it. And so just meeting with you, I feel so much opportunity for collaboration. I love this very gentle, cautious, minimalistic approach. It's just so needed, and maybe a really safe place for people to explore this if they've been struggling.
Well, thank you so much. I really appreciate you having me on, Dr. Watson.
Take care. Have a great day.
Thanks. Bye.
Thanks for listening to Menopause Rescue. If today's podcast resonated with you and you want to take a deeper dive, check out my educational resources. We offer basic membership, which is an archive of over 100 videos on menopausal topics ranging from bone health to libido. We add to this archive every month, so the resource becomes richer and richer over time.